Hello and thank you for joining us for today's presentation on Medicare and CISC Medicare Health Plan options. My name is Cassidy Clifton and I am a CISC account manager. I work to support CISC school districts with CISC medical, dental, vision, and life insurance coverage. I also have the pleasure of working with Julie Brady of Kaiser Permanente, who is graciously joined us to provide an overview of Medicare. In today's presentation, Julie Brady will be providing an overview of Medicare, including Medicare Parts A, B, C, and D, what they cover, and their associated costs. I'll then highlight the options available through CISC post-retirement and some important things to keep in mind regarding coverage, care, and Medicare. We'll also discuss some of the differences between individual plans and group plans, in addition to the differences in the CISC Medicare plans available to you. Before we jump into the benefits, I'd like to provide you with some background on who CISC is and why we do what we do. CISC is a joint powers authority administered by the Kern County Superintendent of Schools. And in line with that, all of their employees are public school employees, myself included. CISC itself is the largest public school pool in the United States. To be clear, we're not an insurance company. We're a community of public schools structuring coverage to meet the unique needs of our members. We're schools helping schools. And it's our mission to provide the best coverage and service to our members while keeping costs affordable and stable. And now I'd like to introduce Julie Brady of Kaiser Permanente for an overview of Medicare basics. Take it away, Julie.
Welcome to Kaiser Permanente's Medicare 101 presentation for CISC, Self-Insured Schools of California. Today you will learn about the parts of Medicare, how to enroll in Medicare, and how Medicare can work with CISC retiree health benefits. Let's look at the basics of Medicare. You are eligible for Medicare if you are 65 years of age or older. If you're under 65 but you live with a disability and are eligible for Social Security disability and you've gone through your 2-year waiting period, you're diagnosed with end-stage renal disease or ESRD, which requires a kidney transplant or kidney dialysis, or you are diagnosed with amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease. What is Medicare? Medicare is a federally funded health insurance program that was established in 1965 and is administered by the Centers for Medicare and Medicaid Services, or CMS. Medicare includes 4 parts. Part A, your hospital insurance, and Part B, your medical insurance. Together, those are known as Original Medicare. Then Part D is outpatient prescription drug coverage. And Part C, or Medicare Advantage, which includes the services for Parts A and B, and often includes Part D prescription drug coverage. Part A is hospital insurance that covers you for inpatient hospital care, skilled nursing care, hospice, and home health care. There is no monthly premium if you have worked 10 years or 40 quarters and paid Medicare taxes. If you did not pay Medicare taxes, you may be eligible for premium-free Part A through your spouse or a former spouse. You can contact Social Security to find out how many quarters you have. Part B is medical insurance that covers your doctors and other healthcare provider services, including lab, radiology, durable medical equipment, dialysis, and some preventive services. Your monthly Part B premium is usually deducted from your Social Security check or Railroad Retirement Board check. You could be subject to a late enrollment penalty of 10% per 12-month period you decline coverage if you do not enroll promptly. You will not have a late enrollment penalty if you receive health coverage through your or your spouse's employer, if that employer has 20 or more employees. The Part B premium is based on your adjusted gross income with a 2-year look back. For 2022, the base Part B premium is $170.10 per month and applies to singles with an adjusted gross income in 2020 of $91,000 or less, married couples filing jointly with an adjusted gross income of $182,000 or less, and married couples filing separately with an adjusted gross income of $91,000 or less. A married couple filing jointly with an adjusted gross income of $250,000 would pay a Part B premium of $340.20 per month per person. The Part B premium can change annually and is released in the fall for the upcoming calendar year. Social Security will send you a statement in the mail that lists your Part B premium and any Social Security benefits if applicable. You have an initial enrollment period when you are first eligible for Medicare. It starts 3 months before the month you are eligible and it goes through 3 months after. Most people are eligible for Medicare on the first of the month of their 65th birthday. However, if you were born on the first of the month, you are eligible on the first of the month prior. If you're receiving Social Security benefits, you will be automatically enrolled in Parts A and B starting on the first of the month you're eligible. If you are not, you can contact Social Security to enroll online, in person, or mail in your application. We recommend beginning your enrollment 3 months prior to the month that you are eligible. If you will continue to receive health coverage through your or your spouse's employer, you can decline Part B but enroll in Part A. If for some reason you did not enroll in Part A and B during your initial enrollment period, you may be able to enroll at other times. There is a general enrollment period between January 1st and March 31st each year. Your enrollment would then be effective July 1st. There is a special enrollment period if you have lost coverage or are retiring. For retirement, we recommend contacting Social Security to begin the enrollment process 3 months before the effective date for your Part B. So if you are retiring August 1st, you could contact Social Security in May to begin the enrollment process. Part D is outpatient prescription drug coverage. You have 3 options for enrolling in Part D. The first one is to choose a Medicare Advantage plan that includes Part D prescription drug coverage. The second option is to find a standalone prescription drug plan that offers only prescription drug coverage. And the third option is to get your Part D coverage through an employer or union. If you're continuing your health benefits in retirement through CISC, you can also receive your Part D coverage through CISC when you choose a Medicare plan. Higher income earners may be responsible for a Part D income-related monthly adjustment amount or Part D IRMA. If your adjusted gross income from 2020 filing as an individual is above $91,000 or filing as a married couple above $182,000, your monthly Part D IRMA is $12.40. Your Part D IRMA can be withheld from your Social Security check or paid directly to Medicare. Similar to Part B, the Part D IRMA can change each year and is released in the fall for the upcoming calendar year. There are 2 main ways to get your Medicare coverage: Original Medicare or Medicare Advantage plans. Option 1, Original Medicare, includes Part A, your hospital insurance, and Part B, your medical insurance. You can then choose to buy a Medigap policy to help cover some costs not covered by Original Medicare. You can also choose to buy Medicare prescription drug coverage or Part D. Option 2 are Medicare Advantage plans or Part C plans, like a health maintenance organization or a preferred provider organization. These plans cover Part A and Part B services and supplies, and they may also include Medicare prescription drug coverage. Medigap policies do not work with Medicare Advantage plans. If you join a Medicare Advantage plan, you can't use a Medicare supplemental insurance policy or Medigap plan to help pay for out-of-pocket costs while you're enrolled in an MA plan. Medicare Advantage or Medicare Part C plans, like health maintenance organizations or preferred provider organizations, cover Part A and Part B services and supplies. They may also include Medicare prescription drug coverage, and those plans are called MAPD plans. If you join a Medicare Advantage plan, you can't use a Medicare supplemental insurance plan to pay your out-of-pocket costs. You may also be responsible for out-of-network provider services unless it is an emergency or urgent care situation. If you join a Medicare Advantage plan, you may have to use a network of doctors and/or hospitals, the facilities, providers, and suppliers your plan is contracted with to provide health care services. There are four main types of Medicare Advantage plans. The most common plans are Medicare Health Maintenance Organization plans, or HMO plans. You get your care and services from doctors or hospitals in the plan's network. If you get care outside of the network, you may have to pay the full cost unless it's an emergency or urgent care situation. You may also need a referral to see certain specialists. Medicare Preferred Provider Organization or PPO plans have a network of doctors and hospitals, but with a PPO plan, you can also use out-of-network providers for covered services. The low-income subsidy is Medicare's extra help program for beneficiaries with limited income and resources. LIS provides extra help with Part D premiums and outpatient copayments to beneficiaries enrolled in Part D. To find out more about the low-income subsidy, contact your local Social Security office or your local Medi-Cal office. Kaiser Permanente offers Medicare Advantage plans known as Senior Advantage in California as well as other regions. The Center for Medicare and Medicaid Services, CMS, evaluates Medicare plans annually in 5 major categories using a 5-star rating system, where 1 is the lowest number of stars and 5 is the highest number of stars assessed. The 5 categories are preventive care, chronic care, prescription drug services, customer service, and member satisfaction. In 2022, Kaiser Permanente received 5 out of 5 stars in all of our Medicare regions, including California. You can learn more about our Medicare plans at kp.org/Medicare stars, or our plans available to CISC retirees at my.kp.org/CISC. I'll end the presentation today by leaving you with some contact information. You can see the phone numbers and hours of operation for Social Security, Medicare, and the Kaiser Permanente Member Services line. Contact Social Security with questions related to enrollment or premiums for Part A and B. Contact Medicare for any Medicare services or questions about Part D or the Part D IRMA. And then, of course, contact Kaiser Permanente if you have questions about the CISC Kaiser Medicare Advantage plan. Thank you.
Thank you for that valuable insight into the world of Medicare, Julie. CISC appreciates your and Kaiser Permanente's partnership in educating our members so they can make informed decisions for the best coverage and care that suits their unique needs. In line with that goal, I'll now highlight the health plans available to Medicare retirees of College of Marin. Before we dive into the meat of this presentation, I'd like to answer one of the most commonly asked questions. What happens to my underage spouse, domestic partner, or child? And I want to assure you that yes, dependents can remain enrolled on their current under 65 CISC plan, provided the retiree, that's you, is still covered by a CISC plan and your district allows your dependents to remain on the district bill. Under age 65 dependents are ineligible for CISC direct bill. Some districts will allow retirees to reimburse the district directly for their family's coverage, so be sure to consult with Ron Owen. Moreover, I'd also like to call out that things like retiring or turning 65 and aging into Medicare are considered qualifying events that will allow both you and your dependents to change plans. However, all subscribers and their dependents must remain with the same health plan carrier. For example, a Medicare-eligible retiree enrolling onto Kaiser Permanente Senior Advantage must keep their family on an under 65 Kaiser Permanente plan. CISC offers several different Medicare plans for retirees, including Kaiser Permanente Medicare Advantage plans, a Medicare Supplement plan through Anthem Blue Cross, and a Medicare Coordination of Benefits plan administered by Blue Shield of California. All plans include Medicare Part D creditable prescription drug coverage. CISC Medicare drug plans do not have a coverage gap, commonly known as a donut hole. The rates on this screen are effective from October 1st, 2021 through September 30th, 2022. All CISC Medicare plans require continuous enrollment in Medicare Parts A and B. Failure to maintain Medicare coverage may result in termination from the plan and a non-refundable $550 monthly surcharge per missing part, up to a total of $1,100 per month. Also, please keep in mind that not all plans are available in all areas. So please contact Ron Owens directly if you have questions on plan availability The Kaiser Permanente Senior Advantage plans are Medicare Advantage plans with Part D prescription drug coverage provided through Kaiser Permanente. Plan availability varies by county. To enroll in a Kaiser Permanente Senior Advantage plan, you must maintain continuous enrollment in Medicare Parts A and B and reside in the plan service area. Members on these plans assign their Medicare to Kaiser Permanente and are unable to use their Medicare coverage with non-Kaiser Permanente providers. Members covered under this plan have emergency and urgent care coverage worldwide. They can also access CVS Minute Clinics when traveling across the United States. The differences between the $10 plan and the $25 plan are highlighted in red. To be clear, there is no difference in what services or prescription drugs are covered by these plans. The only differences pertain to cost shares for certain services and prescriptions. There is either a $10 or $25 office visit copay, depending on the plan. You've got a $1,500 annual out-of-pocket maximum on either plan. Again, out-of-pocket maximums on all plans exclude monthly SISC plan and Medicare premiums and income-related monthly adjustment amounts. Office visits and outpatient procedures are only $10 or $25 per visit and procedure, depending on the plan. Emergency services are a $50 copay, which will be waived if you are admitted to the hospital. Ambulance services are also $50 or $150 per trip. There is no charge on the $10 plan for hospitalization, while there is a $500 copay per stay on the $25 plan. Another notable difference is that members on the $25 plan have a 20% coinsurance for durable medical equipment, while members on the $10 plan do not have a coinsurance. Members on either plan receive a $500 hearing aid allowance per ear every 36 months and a $150 allowance towards eyewear every 24 months at Kaiser Permanente. The Silver and Fit Exercise and Healthy Aging program is also included at no cost. There are notable differences in regards to the prescription drug copays between the two plans. All members receive a 100-day supply for generic and brand medication at $10 on the $10 plan and $20 on the $25 plan. There is also a $20 and a $50 copay for brand drugs on the $10 and $25 plans respectively. As a reminder, there is no prescription drug wrap or donut hole on these plans. Companion Care is a Medicare supplement, also known as Medigap, plan administered by Anthem Blue Cross. This plan requires continuous enrollment in Medicare Parts A and B, and you can reside anywhere within the United States. When enrolling into a Medicare supplement or Medigap plan, you maintain your original Medicare. This means you can self-refer to any U.S. provider who accepts Medicare assignment. Your cost share is zero when the medical service is both approved by Medicare and the provider accepts Medicare assignment. You can determine if a provider accepts Medicare assignment by visiting medicare.gov and selecting Find Care. Alternatively, if you already have a physician, you can ask them if they accept Medicare assignment. If the medical service is not covered by Medicare, then it will not be covered by the plan, excluding some very limited travel coverage. You can reference the section titled What's Not Covered by Part A and Part B in the Medicare and You Guidebook for information on non-covered services. This is a Medicare supplement plan, which means that, by and large, if a service or procedure is not covered by Medicare, then it will not be covered on this plan, but you should refer to the evidence of coverage for more detailed information. This plan picks up the difference of the remaining 20% that Medicare Parts A and B do not cover. As you can see, this results in very few out-of-pocket costs for you, as evidenced by the $0 office visit copays and the lack of cost share for emergency services. However, there is also no annual out-of-pocket maximum on this supplement plan. The Silver and Fit Exercise and Healthy Aging program is also included at no cost. This plan includes a Medicare Part D prescription drug plan administered by Navitas Health Solutions. Like all CISC Medicare plans, there is no coverage gap or donut hole on this prescription drug plan. One important thing to remember is that you are ineligible for Costco's zero copay program for generic drugs. This plan features an $18 copay for generic drugs and a $90 copay for brand name drugs for a 90-day supply. Companion Care and Kaiser Permanente Senior Advantage members receive access to a gym membership program through Silver and Fit's Exercise and Healthy Aging program at no cost. Members can choose from a network of more than 14,000 fitness centers and can also exercise in the comfort and convenience of their own home with one free home fitness kit every benefit year. Each kit may have a DVD, a guide, and/or other products. Members also receive access to healthy aging classes 4 times a year, the Silver Slate newsletter, the Silver and Fit Connected program, which is a fun and easy way to track your exercise through a wearable fitness device or app, and other online tools like a fitness center search, challenges, and classes. The 100A $0 EGWP PPO plan is a coordination of benefits plan administered by Blue Shield. Medicare Part D prescription drug coverage is also included with this plan and is administered through Navitus Health Solutions, which will be discussed in detail on the next slide. As with all CISC Medicare plans, you must maintain continuous enrollment in Medicare Parts A and B. When enrolling into a Medicare Coordination of Benefits plan, you maintain your original Medicare. This means you can self-refer to any U.S. provider who accepts Medicare assignment. Blue Shield members can also access the full PPO network if you're enrolled on the 100A $0 EGWP PPO plan. Your medical cost share is $0 or the defined copay, such as an ambulance, when the medical service is approved by Medicare and the provider accepts Medicare assignment, or if it's a covered benefit under the PPO plan, such as chiropractic care, and you're accessing Blue Shield's full PPO network. Even if the medical service is not covered by Medicare, it may be covered by your PPO plan, and you should review your evidence of coverage for plan details. The plan features a $1,000 yearly out-of-pocket maximum. As a reminder, this out-of-pocket maximum does not include CISC premiums, Medicare premiums, income-related monthly adjustment amounts, nor does it include the separate prescription drug out-of-pocket maximum. There is no deductible on the 100A plan. This plan features a $0 copay or coinsurances for the majority of services. Notable exceptions to this include the $100 copay for ambulance transports and the $100 copay for the emergency room, the latter of which is waived should you be admitted to the hospital. The plan also features a $700 allowance towards hearing aids every 24 months. Members may also access a $25 a month gym membership discount program through Tivity Health. There are 2 different prescription drug plan designs for the 100A $0 EGWP PPO plan, both of which are administered through Navitus Health Solutions. There are no coverage gaps or donut holes on either of these plans. These plans feature access to a larger pharmacy network, which includes Walgreens. Both EGWP PPO prescription drug plans feature $0 generic copays at retail and mail order pharmacies, and members are not restricted to receiving $0 generics through Costco pharmacies. One important thing to remember is that medications such as diabetes supplies and certain cough and pain medications are ineligible for the $0 copay program. The 0 to 20 plan features a $1,500 individual and a $2,500 family yearly out-of-pocket maximum. The 0 to 35 plan features a $2,500 individual and $3,500 family yearly out-of-pocket maximum. All 90-day brand and specialty copays are listed for both retail and mail order pharmacies. As you can see, there are significant savings on brand and specialty drugs when you use the mail order pharmacy. Here is a side-by-side view of the major differences between the CISC Medicare plans available to you. Kaiser Permanente is a Medicare Advantage plan, Companion Care is a Medicare Supplement plan, and the EGWP PPO plan is a Medicare Coordination of Benefits plan. As a reminder, with Companion Care and the EGWP PPO plan, your Medicare remains unassigned. This means your medical providers will be any U.S. provider that accepts Medicare assignment. Moreover, the EGWP PPO plan also allows you to access Blue Shield's full PPO provider network. Kaiser Permanente Senior Advantage members must use Kaiser Permanente providers. Medicare is also assigned to Kaiser Permanente when enrolled on these plans. Kaiser Permanente Senior Advantage members receive their prescription drug coverage through Kaiser Permanente, and Companion Care and EGWP PPO plan members receive their prescription drug coverage through Navitus Health Solutions. With Kaiser Permanente Senior Advantage, you must live in the planned service area and receive non-emergency services in the service area, while companion care members must reside in the United States but are not limited to a planned service area, nor must they receive non-emergency services in a specific service area. EGWP PPO members are not required to reside in the United States. Kaiser Permanente and the Blue Shield EGWP PPO plans all cover additional services beyond Medicare. None of the CISC retiree health plans have a prescription drug coverage gap, but all plans require continuous enrollment in Medicare Parts A and B. Silver and Fit is included at no charge for all Kaiser Permanente Senior Advantage and Companion Care members. Blue Shield 100A EGWP PPO plan members can also access a $25 a month gym membership discount program through Tivity Health. I'd like to summarize some requirements in regards to enrolling in CISC Medicare plans. Regardless of the plan you select, it's vitally important that you enroll into Medicare Parts A and B when you're first eligible, provided you've already retired. If you decide to work past age 65, you must enroll into Medicare Parts A and B for an effective date the first of the month following your retirement. You could be subject to disenrollment from the plan and/or higher surcharged premiums if you fail to maintain continuous enrollment in Medicare Parts A and B. In addition to the monthly premium for medical and prescription drug coverage, you must also pay for your Medicare Part B premium. And depending on your income level, you may also be subject to income-related monthly adjustment amounts. I'd also like to remind you that members can only be enrolled in one Medicare Part D prescription drug plan per CMS regulations. If you attempt to enroll in a second Medicare medical and/or a second Medicare prescription drug plan, you will be disenrolled from both your CISC medical and your CISC prescription drug plan. Members can enroll in a CISC Medicare retiree health plan if they have already retired and either have Medicare or have become newly Medicare eligible, typically during the month of their 65th birthday. Members can change Medicare plans during their district's open enrollment period. Plan changes must be received by August 15th each year for an October 1st effective date. Please contact COM for the appropriate enrollment forms and return the forms and a copy of your Medicare Beneficiary Identifier Card at least 60 calendar days prior to your desired CISC Medicare Retiree Health Plan effective date. Now that we've talked about how to enroll, we'll talk about when to enroll. Those of you continuing to work past age 65 will remain on your current active CISC plan. You should contact Social Security to defer your Medicare Part B enrollment, unless instructed otherwise by COM. Those already 65 and older who are now looking to retire should first contact Social Security to enroll into Medicare Part B and A, if you didn't receive it automatically, for an effective date the first of the month in which you retire, unless COM instructs you otherwise. Then you'll select a CISC retiree health plan and submit a CISC enrollment form along with a copy of your Medicare Beneficiary Identifier Card. If you've already retired and are just now turning 65, you'll want to enroll in Medicare Parts A and B 3 months prior to your 65th birthday. Then you'll select a CISC retiree plan and submit an enrollment form along with a copy of your Medicare Beneficiary Identifier Card. Once again, all enrollment forms must be accompanied with a copy of your Medicare Beneficiary Identifier Card and must be received no later than 60 days prior to your Medicare Part B effective date. Those of you who are already enrolled in a CISC Retirement Health Benefit Plan can switch plans by submitting an enrollment form by August 15th each year for an October 1st effective date. To enroll outside of this yearly CISC enrollment period, you will need a qualifying event, such as a change of address. If you're considering other coverage options outside of CISC, first and foremost, it's important that you plan ahead to ensure you maintain continuous coverage. You don't want to terminate coverage with CISC until you have a new plan in place, because you don't want a gap in coverage. You'll want to compare the plans carefully, and you may consider asking HICAP, the Health Insurance Counseling and Advocacy Program, to help you do so at no charge. You'll also want to ensure you fully understand the Medicare Part D coverage gap, as you may have one on a non-CISC Medicare plan. Lastly, you must notify either your district or CISC, if you're enrolled in CISC Direct Bill, to terminate your coverage. It's important to remember that most retirees who leave CISC coverage will not be allowed to rejoin us in the future. Finally, I'd like to bring some valuable resources to your attention. You'll make your Medicare Part B and A, if applicable, premiums to Social Security. You'll also make any income-related monthly adjustment amount payments to Social Security. You can also sign up for Medicare at Social Security in person or online. If you'd prefer to go in person, I highly recommend making an appointment to save time. As previously mentioned, the Centers for Medicare and Medicaid Services releases an annual Medicare and You handbook, which is a great resource, especially if you're on companion care or an EGWP plan and want to know what isn't covered by Medicare. HICAP, the Health Insurance Counseling and Advocacy Program, is also a fantastic resource that provides free, confidential one-on-one counseling, education, and assistance to individuals and their families on Medicare, long-term care insurance, other health insurance-related issues, in addition to planning ahead for long-term care needs. You can visit them online or call the number on the screen to schedule an appointment. Thank you for watching. If you are a retiree and COM pays for your benefits, or if you're on CISC Direct Bill, please contact Ron Owens with any questions on your plan options, contributions, and costs. General Medicare questions and questions on Medicare costs and any income-related monthly adjustment amounts should be directed to Social Security or HICAP. If you have questions on providers, benefits, or claims, please contact your health insurance carrier at the number listed on the screen. Once again, I'd like to thank Julie Brady for her partnership in educating CISC members on Medicare. I'd also like to thank you for watching and for your participation in CISC Health Benefits. Thank you and be well.